Suella Braverman.
Madam Deputy Speaker, and I'm very pleased to speak in this debate because adult social care is an important issue in Fareham, where the average age of local residents is far higher than most of the rest of the UK, and we have what is known as an ageing population in Fareham. First of all, Madam Deputy Speaker, I want to acknowledge the commitment and progress by this government to social care. We've seen extra funding, considerable extra funding, £1.8 billion for 2019-2020 will be allocated through the Improved Better Care Fund, which represents a 23% increase on funding on the previous year. £240 million of funding will be allocated to support adult social care services to reduce pressures on the NHS. Madam Deputy Speaker, for Hampshire, that additional amount, the additional amount for winter pressures equates to £4.7 million, and with the 3% social care precept that Hampshire levied in 2018-2019, thanks to more flexibility provided from central government, Hampshire does have sufficient funds to meet the increased demand and pressure in this regard. In Fareham, this translates to some excellent residential care homes, which I've had the pleasure to visit. Hawthorne Court, Gracewells, Hamble Heights, the Ferns at Titchfield and Abbeyfield are just a few examples of frankly brilliant care provided for our elderly residents in Fareham, where they are treated with dignity and compassion, many of whom are publicly funded. At Fareham Community Hospital, with whom I've been working very closely since my election in 2015, chairing Fareham Community Hospital Task Force, we are seeing an expansion in GP services thanks to the collaboration of local surgeries, so that thousands of patients are able to see a GP on the day they request it, a massive improvement on previous years. We're seeing the charitable sector thrive in Fareham. I recently met with Fareham Dementia Friendly for Fareham and Hampshire. And I know my neighbour, who's sitting on the front bench, the Minister for Social Care, has also met with this charity, and they are doing some fantastic work for raising awareness in our local community for amongst our shopping centre, for example. Myself, I've taken the Dementia Friends training, and also amongst young people and professionals, so that we can work more effectively and understand the challenges faced by those with dementia. And we're seeing other charitable organisations like One Community and the Good Neighbours scheme, which is really helping local elderly residents in accessing healthcare services. So these are real and tangible reflections of government funding on the increase, commitment from local communities, and real progress at national and local levels. All this, it has to be said, has been achieved in Hampshire at the same time as Hampshire, and indeed Fareham, having one of the lowest council tax rates in the country. So despite continued pressure and demand, through prudent financial planning, Hampshire County Council and Fareham Borough Council have been able to maintain some excellence in delivery of public services. I need to provide context. That £4.7 million compares to an estimated growth of at least £10 million at the same time as Hampshire County Council needing to remove £43 million from the Adult and Health and Care Department to cope with £45 million worth of extra costs, mainly due to buying in care from the private market. And that cost has gone up in part because of pressure from the national living wage. All of that combined means that Hampshire does face serious financial challenges on the horizon, and support will be needed through the spending review. Secondly, Madam Deputy Speaker, I need to talk about, despite that evident and undeniable progress, the human impact when things sadly go wrong. I've now met with too many residents in Fareham who have found the continuing healthcare application system nebulous, harsh and expensive. And in some cases, this has been heartbreaking. My constituent, John White, came to see me about his experiences of caring for his elderly sister-in-law who was suffering with Alzheimer's disease. Funding applications were initially rejected by West Hampshire Clinical Commissioning Group. There was a lack of coordination between the CCG and the County Council. The appeals process was severely delayed, and only after 6 years of trying was funding retrospectively granted. Sadly, that was too late, and Mr. White's sister-in-law had by that time passed away. Mr. White's case is not an isolated one, Madam Deputy Speaker. The application process is not patient-friendly, and families and carers can be treated with suspicion rather than with support. The process and rules, and this is what I'm hearing from constituents, are designed in a way that means only a few applications are successful on the first attempt. And many people simply don't have the energy to keep fighting the system. They are beaten into submission. I fully appreciate the difficult financial circumstances with which the government found itself in 2010, which is ultimately the root cause of the problems that we see today. And I'm also grateful to the Minister for Social Care, who's in her place, with whom I've raised Mr. White's case, and also the local government minister, who's met with Hampshire MPs and Hampshire County Council to discuss our funding in Hampshire. I know how hard they are working to improve the system at the central government level. But we need urgent reform to the process and the structure to improve coordination between healthcare providers and commissioning groups and to improve patient experience. We need to act now so that the government's undeniable commitment to our elderly and vulnerable residents is not squandered, and so that patients are rightly put at the heart of how our social care services and NHS services are delivered. I have no doubt about this government's commitment, and I know that we can also do better. Thank you.